We need to understand the determinants that act as a risk and or protective factors in relation to a health issue, such as spina bifida, low birth weight, fetal alcohol syndrome, and gestational diabetes. Spina bifida is a condition that occurs when the neural tube in the embryo fails to close properly. The effects of spina bifida will vary from case to case, depending on the number of nerves exposed and damaged. In some cases, symptoms will be minor, but in more severe cases, the individual may be paralysed and require assistance to carry out daily tasks such as feeding, washing, and toileting. Biological determinants. Certain genetic conditions can increase the risk of developing spina bifida, including trisomy 13 and trisomy 18. Trisomy 13 is a condition in which there are 3 copies of the 13th chromosome instead of the usual 2. In trisomy 18, there are 3 copies of the 18th chromosome. These conditions are rare and contribute to a range of development issues in addition to an increased risk of spina bifida. There is a relationship between spina bifida and the age of the mother. The overall prevalence of spina bifida is higher at the extremes of reproductive age, that is among women aged less than 20 years and women aged 35 years or more, compared to those aged between the ages of 20 to 35. The exact cause of this relationship is still not known. Behavioural. The use of saunas and spas exposes the pregnant women to a hot environment and increases body temperature. Excess heat during early pregnancy has been shown to increase the risk of spina bifida. Folate is a nutrient that is essential for normal cell division and the production of new cells. Folate is particularly important during periods of rapid growth, as occurs during the prenatal stage. Folate has been shown to be a significant protective factor in the development of spina bifida. The neural tube closes early in the pregnancy, often before the woman knows she is pregnant. As a result, all women of childbearing age where pregnancy is possible should ensure they consume adequate amounts of folate. Physical environment. Exposure to excessive heat early in pregnancy may increase the risk of spina bifida. If the physical environment is excessively hot, the risk may be increased. Exposure to agents such as solvents, pesticides, and X-ray radiation may also increase the risk of spina bifida, although the exact link is unknown. The prevalence of spina bifida increases the remoteness of residence. The exact reason for this trend is not known, but it may be linked to reduced access to healthcare and differences in food availability in rural and remote areas. Social. Maternal fever raises body temperature and may increase the risk of spina bifida as a result. Women who experience illness that increase body temperature may be at an increased risk of having a baby with a neural tube defect. Accessing healthcare prior to pregnancy can increase parental knowledge of folate intake and other precautionary measures such as avoiding hot environments. This may reduce the risk of spina bifida. Those with adequate education surrounding maternal nutrition and pregnancy may ensure folate intake is adequate prior to conception. This can decrease the risk of spina bifida in the unborn baby. Low birth weight. The birth weight of babies has a significant impact on health and individual human development in both the short and long term. Adequate birth weight often indicates that the body systems are developed optimally in the prenatal stage. Low birth weight, on the other hand, may indicate that the body systems are underdeveloped and the risk of a range of health and development problems increases. Biological. Babies born under 37 weeks gestation have an increased rate of low birth weight. Less time spent in the uterus means less time to grow and develop, especially in the fetal stage when the rate of growth increases significantly. Maternal age also has a relationship with birth weight. Young mothers, especially those under 15 years of age, and older mothers, those over the age of 45, have higher rates of low birth weight babies. Babies born to parents who are of small stature or of low birth weight themselves may have an increased risk of being born with low weight. Genetics appear to play a part in this relationship. Behavioural. Maternal food intake is vital for supplying the unborn baby with the nutrients required for optimal development. An inadequate supply of nutrients can lead to underdevelopment of the fetus. Smoking, excessive alcohol consumption, and drug use during pregnancy contribute to higher rates of low birth weight. Physical environment. Environmental tobacco smoke can have similar effects on the unborn baby as maternal smoking. Exposure to tobacco smoke increases the risk of a low-weight baby. Women in remote areas may have fewer health services in the areas in which they live. This can decrease access to healthcare, which can mean that slowed growth is not detected and goes untreated, contributing to a low birth weight. Social. Parental health is a key factor contributing to birth weight. Illness of the mother during pregnancy can increase the risk of having a low birth weight baby. Infections in the uterus can lead to early labour, while other infections such as chickenpox and rubella can cause slow growth. Parental education and income influences the behaviours of the mother during pregnancy. Those with the knowledge and the means to access resources such as a nutritious food intake may reduce the risk of having a low weight birth. Prenatal health care includes constant monitoring of the baby's growth and development. If the fetus is experiencing slow growth, interventions such as dietary change can be put into place to reduce the risk of a low birth weight. Fetal alcohol syndrome. The consumption of alcohol during pregnancy has been shown to impact the health and individual human development of the unborn baby in many ways. The severity of the impact will depend on a range of factors, including the amount of alcohol consumed and the susceptibility of the fetus. Common effects include harm to the development of the nervous system, including the brain. Research shows that alcohol can damage developing brain cells. Impaired brain development in those experiencing fetal alcohol syndrome can impact on intellectual development and contribute to behavioural problems throughout life. Individuals who experience poor mental health during pregnancy may be more likely to consume alcohol in an attempt to numb feelings of sadness and despair. The health and development of the fetus may also be affected as a result. Gestational diabetes. Gestational diabetes is characterised by high blood glucose levels. It occurs in around 5% of all pregnancies and can impact on the women in a number of ways, including high blood pressure, preterm labour, longer hospital stays than mothers without gestational diabetes, increased risk of developing type 2 diabetes, increased risk of cardiovascular disease. Gestational diabetes also increases the risk of many adverse outcomes for the developing baby, including higher than normal birth weight, respiratory conditions, and jaundice. There are numerous factors that can either decrease or increase the risk of developing gestational diabetes. Biological. Women who have a genetic predisposition to type 2 diabetes are at a higher risk of developing gestational diabetes during pregnancy. Advancing age has been noted as a risk factor for gestational diabetes. The proportion of increased with age from 4.1% for women aged under 35 to 7.3% for women aged 35 to 39 and 10.3% for women aged 40 or over. Body weight is one of the major factors in determining the risk of gestational diabetes. Overweight and obesity at the time of fertilization significantly increase the risk factors for the development of gestational diabetes. Ensuring body weight is within the normal range before pregnancy occurs can reduce the risk of developing gestational diabetes. Behavioural. Food and alcohol intake prior to and during pregnancy can impact body weight. Although gaining weight is a normal and required aspect of pregnancy, those who consume an energy-dense diet and consume alcohol are at greater risk of becoming overweight or obese, which increases the risk of gestational diabetes. Physical activity acts to burn off excess energy. Sedentary lifestyles, on the other hand, can contribute to weight gain and gestational diabetes. Physical environment. Women who live in areas where health care is accessible may be able to receive health education prior to pregnancy occurring. They may be provided with the strategies to assist them in losing excess body weight prior to becoming pregnant. Social. Parental education is a key factor in preventing the onset of gestational diabetes. Those who are educated are more likely to understand the risk factors for gestational diabetes and act to reduce their risk of developing this condition. Having adequate income can assist in affording resources such as healthcare and nutritious foods, which can in turn assist with weight management and decrease the risk of gestational diabetes. Cultural factors can prevent some people from accessing healthcare. Indigenous Australians, for example, are less likely to access healthcare during pregnancy, which can contribute to the higher rates of gestational diabetes experienced. Body weight also plays a role in this difference, but access to healthcare could provide knowledge about the risks associated with development of gestational diabetes.